Okay, good morning, everybody. We're still missing a few, but I do want to get started because we are recording this, and this is being live streamed across our network. So we want to start as close to 10 as we can, so some may be joining us a little bit later. But first of all, thank you for being here. I appreciate you coming to this seminar. I'm Jerry Hafer. I represent Amac and the Amac Foundation. How many of you are aware of Amac? Excellent, excellent. Those of you that are not, there is some literature on the table in the back. Feel free to pick some of it up. But let me talk a little bit about who we are and what we do. AMAC is the Association of Mature American Citizens, and it's a nonpartisan member benefits organization. It's really a conservative advocacy organization. We have about 2.4 million members and growing steadily, growing rapidly, as a matter of fact. So it's getting to be a large organization. Was created to serve the conservative population age 50 and plus, people that felt that their interests were not being adequately represented in Washington. That's really what the creation of AMAC was all about, almost 15 years ago. So still a relatively new organization, but as I said, growing pretty rapidly. The AMAC Foundation is AMAC's nonprofit arm. We are based, AMAC incidentally is based in New York on Long Island. The AMAC Foundation is based right here in Central Florida. And basically our mission is to support and educate America's seniors. That's what we do. We're a nonprofit. And our services are basically fall into four primary categories. Public seminars like this one. We do usually 2 to 3 seminars a month of this type, but since the pandemic happened 2 years ago now, we kind of had to stop that. So we're getting back into it now. In that interim period, while the pandemic was here, we were doing virtual Zoom. You're probably all familiar with Zoom. It's become kind of a household word. We were doing a lot of Zoom sessions during that period, but historically we do about 2 to 3 a month on topics that are important to seniors. Anything from Social Security, veterans issues, aging issues, health issues. So about 2 to 3 a month on that. We do a lot of publications. We've produced some publications about Social Security. Our Social Security Handbook was published about a year ago, and our website has a blog page where we publish an article of importance to seniors every Monday morning, and there's a lot of other published material available on our website. So we do a lot of publications on issues that are important to seniors. We also operate 2 topical websites, information-packed websites. One is called socialsecurity.report.org, and the other one is medicarereport.org. Those websites are updated every weekday, 5 days a week. We publish breaking news about those subjects, just keeping people informed about what's going on in Social Security, Medicare, and healthcare. So that's the third thing that we do. And the fourth thing, which is really our flagship program, is our Social Security Advisory Service. I think it's fair to say there's no place for people that are aging into Social Security or perhaps that are already in Social Security and have questions. There's really no place for them to go to get credible information. And so about 5 years ago, we formed the Social Security Advisory Service, and we have 7, well, actually 6, we have 1 in training, trained and accredited advisors who are accredited by the National Social Security Association to research questions and provide credible answers. And it's an extremely active service. We handle roughly 600 inquiries every month from people. And we're approaching the point of, I think later in November, we will have reached the 20,000th counseling session that we've done since we started this program back in 2016. So it's become a very active service for us. Basically, people can email us a question or telephone us a question or just kind of walk in to our office, and it's something that we really value doing. It's a valued service, and answering a Social Security inquiry can take us 10 minutes, or it can take a week. Just depends on how complex, because Social Security is situational. The answer to the question will depend a lot on the individual situation, so we need to analyze that and provide a credible answer. One thing I want to mention is everything we do is done for the public free of charge. We are a nonprofit. We do not charge for anything that we do. And people are really gratified at that, especially, you know, there are services, for example, in Social Security that you can sign up for that will answer your questions, and they're going to charge you $150 or something like that. But we don't charge for anything. So those are the primary services that we do. And we also are very active on the veterans front. We are kind of the leader of Amac's Veterans 2021 project, 2021 Veterans Project. And with that project, we've done a lot of publishing of material in support of veterans, suicide prevention, that sort of thing. We're developing a Vso Network Effort where we're trying to organize to bring the major VSOs to the table in a collaborative venture to get together and talk about what services they do in support of veterans and how they might better share what they do. That's just getting off the ground. It's easier said than done because VSOs are very large organizations, most of them, and it's hard to get to the right people to want to come and be a collaborator with us. But we're working on it, and we think it's going to happen in the next couple of months. We are also working closely with some specific VSOs. VSOs are veteran service organizations, if I didn't mention that. For example, there's a VSO called One More Day that's dedicated to suicide prevention. We are working with them to publicize the seminars that they do. They're also creating a podcast series that we're going to participate in with them. So we're trying to lend support that way as well. We also, as part of this project, created a veterans program catalog. We call it a clearinghouse. That's something that may be of interest to you. And I want to step you through a couple of the pages quickly. I won't spend a lot of time on it. It's available on the amacfoundation.org website. And basically, when you go to the amacfoundation.org website, this is the landing page. And at the top, you'll see a For Veterans button. And when you click on that, you go to this page, which basically has a long list of categories where we have posted programs, services, legislative bills, things like that, that are relative to those categories. And just as an example, I circled canine support. I'm really an advocate for dogs. We have several at home, and so I picked that one. It's popular for me. So I picked it just to show you the level of detail. And when you click on that button, then you get programs that are categorized as canine support. And for example, I circled canines on the front line. And when you click on that, you go to a detail page that tells you what that program is, provides some background information. It also includes the URL if you want to look at their website, contact information, telephone and email. You know, how, if you have an interest in that, how you can get in contact with them. So that's just an example of how the database works. And here's another way you can use it. If you're interested in finding information on a particular topic, you can use the search engine. For example, I just arbitrarily entered PTSD, very popular topic. And if you enter PTSD, it'll take you to all the database entries that have anything to do with PTSD. And as an example, I highlighted this one because I wanted to mention that we do any legislation that's introduced in Congress that affects the veterans, We examine it, and our AMAC action folks take a look at it, and we take a position in response to that legislation, and we've entered all those in this database. So you can see PTSD-related legislation. So again, I'm just doing this to show you what's actually in the database. That is a quick overview of AMAC and the AMAC Foundation. I don't want to take too much more time because Ben has a lot of material. I don't want to eat into his time too far. So, about today. Today's seminar is Veterans Benefits, and our featured speaker is Benedetto Mangiovi. I just like to say that name. It just kind of rolls off the tongue so nicely. But Ben is with Vitas. I'll mention that in a minute. Vitas is Vitas Healthcare, America's largest, what would you say? Hospice? Yeah, hospice service, I suppose, would be the right way to say it. We have partnered with Vitas on a number of seminars in the past couple of years, and we have a great relationship with them. And their speakers bring us material that is so relevant to seniors and veterans that it's great for us because we don't have to recreate it. And so the partnership we have with them is just tremendous. But today's speaker is going to regale us on benefits, veterans benefits. Not a bad-looking guy. I was reading an article in the Leesburg Daily Commercial just recently about Ben, and I picked up some tidbits that I'll use to introduce him. He's a native of Hackettstown, New Jersey. I'm from Pennsylvania, so I know Hackettstown. He's a veteran. He served in Iraq, Kuwait, and Turkey, so he's been in some theaters. Has a doctorate from Liberty University, and that led him to become a successful businessman, an entertainer, a college faculty member, and a substance abuse counselor. Man of many, many talents. He currently serves as Vitas Veteran Liaison, as I mentioned. He's married to Lisa Marie. He's a proud father of a son serving as a paratrooper in the 82nd Airborne, and he's the father-in-law of a soldier based in Fort Carson, Colorado. So he has many tentacles into the veteran community. His hobbies are kayaking, playing piano, and singing. So I don't know if he's going to be singing part of his material today. It could be, I don't know. And also, he hastens to point out his other hobbies include anything Lisa tells him to do. He goes by a few nicknames, one of which is Detto, all-around cowboy, Renaissance man, and all-purpose back. I just call him Ben. It's simpler that way. So with that, I'm going to turn the program over to Ben Mangiovi.
Well, thank you, Jerry. First, I'm going to say I was going to do an introduction, which I was nervous about doing. I'm always nervous about doing an introduction. And I did not expect this. So, Jerry, I appreciate that in the AMAC Foundation. This has been a wonderful relationship since I've got to know them. But one thing I'll continue on with that vein is why work with veterans, why be a veteran liaison, why provide education in this capacity, and why am I compassionate and excited about it? Well, I'll let you know, I did come into the military later, but I was so compelled by the heart of the people that serve in the military. Matter of fact, by a show of hands, who here has served in the military? Right, several people. All right, that's fantastic. I didn't understand so much about the military. And one thing I'll share with you is the military is a different culture. It just is. It's a different way of thinking, different form of rules and settings, where there does need to be a continued education, which is what we're going to be discussing today. What actually happens with veteran service, what benefits are available to you, and actually for different stages of life. When I first came back from my first tour in Iraq, I we were running for cover without me going into the story, but I stepped in a hole, and in the adrenaline and being full of battle rattle and covered, my foot like went to the side of my ankle. Well, in my adrenaline, I took the back of my M16 and I smacked my foot real hard in my boot, and it went back in place. So of course, that's not exactly the medical thing to do when you have an injury like that. But so fortunately, that injury did not. I didn't even feel that injury until the day I arrived back, right before I went home, and I literally could not walk on my foot. And so from that, I begged them, please just send me home. I miss my family. And they sent me back. They wrapped up my foot, and they did this thing called a line of duty, which, is anybody familiar with that? If you get an injury during the line of duty, it's in my record. I didn't realize the importance of that, but when I went back home and I went to the VA, I didn't know where else to go because I'm a reservist. The VA, the first thing they said, are you registered with us? And I was like, well, what do you mean? I'm in the military. And it turns out that's another process. Did anybody know that? Just because you served in the military, you're not automatically in the VA, which blows my mind. But a lot of people don't know that. And a lot of what I'm going to talk about today has to do with that component. Matter of fact, to do you a favor, I'm going to point out to you how often that is. And you might think it's funny because it seems like I'm going to be repetitive, but the importance of registering, there's a great value to that. Because when you do register, obviously the benefits then can kick in. So for myself, I ended up having, I'm not a medical doctor, so it's plantar fasciitis. Nobody know? Fasciitis? Okay, we got some medical professionals in here, that's good. So anyway, it turns out that's what was wrong with my foot. Fortunately, they say the ligaments, there was some damage and trauma, but not so bad as much as the plantar fasciitis. So they did therapy for me, and obviously you can see I'm walking around. I have molded foot inserts through the VA, and so it was a great service to me. So I guess the reason why I share that story before we get started is to let you know I know what it's like to work with the VA. I know what it's like to get referred. I know what it's like to be sent down to Lake Nona. I know what it's like to be working with a specialist. And it seems like every time you go in, it seems like you're just getting shuffled around. Has anybody experienced that before? It's like, does anybody really know who I am? It feels like you're just kind of getting shuffled around. But the benefit is it is a system that does work, but you have to know how to navigate it. So we're going to talk about that. And of course, when you see VTOS, in the back of people's minds, I'm going to answer this question because I always get hammered with it later. What does VTOS mean? It's nobody's name. It has nothing to do with veterans. It is a Latin word. That means life-giving. That's all it means. And so, but VTOS, like he mentioned earlier, is the largest contract holder for hospice healthcare with the VA. And what's really nice about that is it allots for me to be able to work with you to provide public education. There is nothing that I sign up anybody for. If any of you have seen me before, it's because I'm here a lot. I'm in the villages quite often. I do about 2-3 times a week. I do events for veterans. I participate with events with the other organizations like the VFW, American Legion, and AMVETS. And I don't know, I just try to do as much as I can to be in front of veterans, but I am also an honor guard soldier. So I do get to spend a lot of time out in funeral sites as well because veterans mean that much to me. I want to be around anything veteran. I want to be around the feeling, the understanding. Just last week, I do bedside salutes. I'm with veterans on their last breaths, and I'm saluting them. It's very hard for me, but at the same time, it's very important, and I'm honored to do it. So sorry to mean to get choked up on you. Once again, before I get started, there are some flyers. Some of you I see have them on your tables there, but it kind of talks a little bit about benefits to veterans. What you're going to see in this presentation, is going to be a lot of information. So some of it, you're going to feel like you're getting like exposed. But at the same time, you're not expected to know all this from this. Matter of fact, the idea behind this is general knowledge. Some of these materials you'll see do cover more details that we have out there. 10 facts to know about hospice care when you start getting, because it will cover palliative and hospice care. And then there's a booklet out there that says Pledge to Our Veterans, which gives you more details about what we actually provide to veterans. And then finally, there's one there, hospice care tailored to veteran needs. Once again, they're all out in the front. And there's a booklet I grabbed. Unfortunately, I only have one of these, but it's worth grabbing a hold of at your local VSO office. It's the Benefits Guide 2021, which it does cover the importance here of becoming educated, but also the importance of registering. But now we'll talk about that. And the information that's in this presentation, by the way, a lot of it also is what we use, like we do the same presentation certified, and it's updated regularly for CE credits for medical professionals. So I'm not going to go into that level of depth. But what I am definitely going to do is at least expose you to it. If you have some general questions, once again, I will answer general questions, but if the more in-depth questions, I'm going to ask that we talk about that afterwards. And by the way, AMAC, that resource that Jerry was sharing with you, I use that very often, very often. It's a great resource also for VSOs if you're not familiar with VSOs. They are a great asset to you. But moving right along, I don't have a clicker, so we're having to do this a little old school. But anyway, there's the CE credits that don't apply to y'all. But as you can see, the goal for this particular presentation, it is for you as well, but it is also to provide information for members of the medical community about benefits and resources for veterans. Any questions on this? Okay. All right, objectives. We're going to identify some basic eligibility requirements. And I'll point out here pertinent to federal benefits of veterans, their families, members, and their survivors. There are different benefits that cover all those different areas. A lot of people don't know that. We're going to talk about that. We're going to discuss the general buckets that describe the 8 VA medical priority groups. 8 groups. 8 groups. So anyway, explain VA disability compensation. The word pension there. Okay, I'm going to say this ahead of time because I usually get this question. That's their term. They say the word pension, but it's really aid and attendance. But they call it a pension because it's money, but it really has nothing to do with retirement benefits. It's really is tied to income, and we'll talk about that. If you see this on paper, sometimes that's confusing. And everybody knows what that means to have terminology from the military not really mean the same thing in the civilian world. Has anybody experienced that? So it's just crazy. Anyway, we do have our own jargon. Explain VA burial benefits, which there's a lot of great benefits there, and discuss how and who to coordinate at the VA medical facilities to help veteran patients. All right, some of this will go by quickly, but some of it I will read because it's important. All right, general eligibility for most veterans, this is in red, I really want you to pay attention to this, requires discharge from active military service under other than dishonorable conditions. Active service means full-time service, other than active duty for training as a member of the Army, Navy, Air Force, Marine Corps, Coast Guard, and yes, the United States Space Force. Isn't that exciting? You know, active duty for training is not the same as active military service. All right, this is great news. The Department of Veteran Affairs is actually 3 departments. 3 departments. I've actually had people tell me, oh, I didn't get qualified with the VA. Well, which department? It matters. So the first one you can see there at the top is the VHA. And then, of course, we're going to look at here at the Veterans Administrative Benefits, the VBA, which is usually connected to money. And, of course, National Cemetery Administration, obviously, is connected with cemetery. So we're going to break all those down. VHA is medical care, must be enrolled. Like I mentioned, even I came back from deployment and I had no idea I had to enroll. This is something you just want to get out of the way, especially when you're of sound mind and body. This is a hard conversation for me, but I have had patients where they're not registered and they're already on hospice care, and we'll talk about that. But they can't get the eligibility. It's harder for them. It's harder for the family. It's much harder for the family. But anyway, VBA, think money, which is disability compensation, pensions, which I said we'll discuss, funeral allowances. Utilize a veteran service officer to file the requirement paperwork. Utilize a veteran service officer. You want to utilize a veteran service officer. This is a big deal. We have a lot of great ones in this area, and I think some of the names I would mention, I think Jerry's very familiar with, which we could talk about afterwards, but make sure you utilize those folks. They're here for you. Oh, and why do I say that? Because if you go to the VA, many times you'll get a packet of paper, and if you're like me or my wife, we're looking at each other like, what do we do with this? And you're trying to figure it out. Anybody experience that? They hand you this packet of paper. A VSO goes through it with you. They help you, they know the language of that paperwork. That's the importance of using a VSO. Anyway, NCA, burial and memorial benefits, the general rule is to utilize a funeral director. By the way, before I move on, has anybody experienced that process in this room? All right, there's not much I want to kind of add there, but sometimes folks have questions about that early in. Do you mind answering the question, how was your experience when you dealt with that with the VA?
Was buried through it, and brother-in-law that was buried through it. So I wasn't directly involved, but I was kind of on the sidelines.
I understand.
Went through quite well, all the way around, both of them.
Did they?
One was not signed up under the VA because he never did it.
Okay, so he experienced that as well. That's a hardship. So the one thing I was wondering if you were going to bring up was the idea that you get the ceremonial service where they present the flag. Did you see all that?
Oh, yeah, I got that on tape.
Yeah, it's beautiful. It's beautiful. So, and I like to bring that up because it's beautiful when they do set that up. The role of the service officer is very important to get questions answered, to submit claims, and can enroll for VA medical care. Notice how now that you know the three components, it's important that you see that difference, the VA medical care. Follow up as patient's designate agent. Now, if you are in the VA system, let's just say you're coming from another state, like Jerry mentioned, coming from Pennsylvania, I've had folks ask me, does it matter if I have somebody down here in Florida? The answer is absolutely. Absolutely it matters. Because what happens if you have to determine any additional services or care as you're under care, you have to wait for that person in that other state to evaluate you and make recommendations for you. Well, perfect example, you know, I'm not trying to share too much about personal family, but I have a family member that travels outside the country, and they got stuck in another country under medical care, and they needed a procedure done, but they couldn't get the advice because the person who they were trying to, the person over in America, when they saw them, they didn't have those conditions. They changed, their body changed. And my wife, we joke about this because the other day I woke up in the morning and I got out of bed, and for no reason my knee was bothering me. And I'm like, what is this all about? My wife says, you're getting older. So for instance, just waking up from day one to day two, your body changes. And when you're evaluated by a medical provider, they keep up with that. So it's a good idea to have a person, you find someone down here if you are coming from up north. All right, so service connection. An illness or an injury that affects body or mind caused by military service already existed but was aggravated by military service. That's when I mentioned the LOD. Some people in this room, you may probably have something that's popping into your mind. Anything anybody want to share when you think service related that you're thinking of?
Yeah, when I was in the service, I was aboard a ship and I was in Nam, and we fired every night. And the gun mount was like 5 feet from my rack. And later in the years, now I got hearing aids. But this was, I left the service in '69, so I never went to the VA because the VA in Illinois was not rated very well. So
Okay.
I never joined it. Now I understand that it's based on your income to get into the VA. Why is that?
Well, that's pension benefits. I like that he's talking about that. There's actually more information I can provide you, which will have to come through a VSO. But one thing I will just kind of put out there, I've dealt with this, and Jerry knows what I'm talking about. Sometimes you just have to be reevaluated because your condition, it may be aggravated by military, but if you have a condition service related and they're showing, hey, there was a problem with his hearing, if it becomes worse, you could be reevaluated for disability. And that does happen. And I saw you were shaking your head over here. You had something you want to add to that?
I have a friend with a hearing problem that developed originally in the service.
Right.
And now he has hearing aids that are fantastic.
Right. So
Didn't think they'd get anything for it, but
this is common.
yeah.
This is very common. And actually, the scenario he just brought up was very common. Understanding hear loss, things like tinnitus, very common. As of yesterday, I had a patient who got new hearing aids. And it was kind of interesting. He was like, how do you put this stupid thing in? So, and he had it all backwards and everything like that. And I don't know what I'm doing. So fortunately, we were around another veteran, and they said, this is all you got to do. And they stuck it in his ear.
How about getting trained?
Right, it was good, yes.
Does it have to be documented why they were active in order to get that?
Some cases do. I'm going to cover that. Let's keep that. You're a little ahead of me. That's a great question. So let's see, this chart is, I promise you we'll cover that. Honorable, administrative, general administrative. Y'all can read the rest below. Obviously, if you're let go for any of those reasons, you're not going to have benefits. Any questions on this slide? Okay. Before you going over that. Defined war periods, and there's a reason why I'm bringing this up. So these are recognized war periods by the VA. There are, as you were kind of moving into, we're talking about, there are certain benefits or certain criteria for medical care or propensity of care for these different periods. Exposure. A lot of folks know what I'm talking about when I mention things like Agent Orange. Vietnam period. Any questions on this slide? Okay. All right, separation papers. You must have to get benefits from the VA. Okay, so I got really great news here for you, and a lot of people don't know this. It used to be pretty hard to get a DD-214. Does everybody know what that is? Your discharge form? I love it when I see those T-shirts that say graduated from the University of DD-214, you know. So basically done. But anyway, so this website works out really well. My wife didn't have her DD-214 for years, and they actually told her it was lost or misplaced. And I have a lot of people who say this, they don't know where it's at. Just go on there, you put your name, it's real full, in a couple of days, they mailed it right to her. So apparently, even for folks that I recently had somebody who was in World War II, they wanted their discharge paper. They said that it doesn't exist anymore. They were listed on this website, and they were able to get a copy of it. Don't you find that interesting? Seems like that should have happened years ago, but that's just now happening. So anyway, I figured that you should know. This is the update, and that's a website worth knowing about, www.archives.gov. And of course, as you guys can see at the bottom, who will know about this? Your VSO. Your veteran service officers, they're required to go through this training to be aware of this information. So even if you forget everything I'm saying, go to VSO. They will help you. But there's what they look like. Not much to it. Other documents which may be needed. When you first go in, these are just documents you want to have available. People ask about this power of attorney. Does the VA provide that? The VA does not provide that. If you need a power of attorney, if you're in that capacity, you need one, that's something you would probably get from your legal advisor. I'll just put that out there. It's not a VA document. Marriage certificates, obviously, corresponding death certificates, and of course, VA and pension, which we were getting, being qualified. They use a lot of your investments to qualify you for pension benefits, and we'll talk about that. I will give you actual numbers on there, not to be a mathematical genius so you see it. All right, so this is ways to get enrolled for the VA medical service. Obviously, these are updated numbers. We try to make sure we provide to you. But more importantly, if you look at the bottom, go to a local veteran benefits service officer. That's your VSO. Once again, you're going to see this theme again and again and again. Somebody asked me, are these guys who work for the VA? Many of them know. They actually work for the state. The state provides these folks. So they have an interest in helping you in the sake that it's how they keep their job. They want to do the right thing to help you. So during enrollment isn't complete until the veteran has attended an initial vesting visit. Does anybody know what that is? All right, talking about it's why you want to do it while you're of sound mind and you're able to do it now, because that visit does need to take place with a physician. It's a quick visit. I thought it was going to be some big ordeal. The guy literally sat down with me, asked me a couple questions, and I thought, is that it? He goes, yeah. We walked out and I was done. Not much to it, but you have to do it in person. Healthcare benefits. During enrollment, each veteran is assigned a priority group. There are 8 priority groups. That still blows my mind. But anyway, a VA must do this because it does not have unlimited funding and resources. All right, and we'll talk about it. Medical benefits for veterans. General buckets for the 8 priority list. It's medical or psychological issues caused by or aggravated by the military service. former POWs, Purple Heart recipients, when and where they served, and income. Priority group 7 and 8 differs by county, catastrophic disability. Priority group 4. Any questions on that? We're about to break it down. We're about to give you an exploded view. Okay. All right, here we go. Exploded view. Priority groups. First group, veterans with a VA-rated disability of 50% or more, or unemployable due to service-connected conditions. It's kind of self-explanatory, but if you already have 100%, or if you're already in that group, there's all kinds of things. Many times it's people who get shot, very common. You know, terrible shoulder injury, the military takes you out, but a lot of times it can also be for multiple deployments. I've seen that, where I worked with somebody who was deployed 6 times. They were a sniper, time behind a sniper rifle. They didn't stabilize very well, just being honest, for whatever reason. They saw a lot and they didn't realize they weren't okay. So, but anyway, that is determined by the VA. Group 2, but the reason why I just said that, by the way, is because these are factors they look at. There's actually a checklist on these when they actually qualify them. Anyway, group 2, 30 to 40% disabled, former POWs, Purple Heart awardees, veterans with 10 to 20% disability rating, or were discharged for disability incurred in the line of duty. That's where I fit right now. I've actually had 3. But look, I'm going around pretty good. At least that's what I say today. Tomorrow morning I could wake up with something hurting. Who knows? But anyway, group 4, veterans who receive increased compensation or pension based on their need for regular aid and attendance. Now, once again, the word aid and attendance, when you see the word pension on your VA paperwork, that's what that is. Or by reason of being permanently housebound. Oh, does it say there? No, it doesn't. Veterans determined by VA to be catastrophically disabled. That's group 4. Priority group 5, non-service connected veterans and non-compensable service-connected veterans, 0% disabled, with annual incomes below the geographical adjustment income limits. As you see that number, veterans receiving VA pension benefits. And once again, pension is referring to aid and attendance. Veterans eligible for Medicaid programs. Group 6, compensable, help me out, compensable? Thank you. It's, believe it or not, I've always had a problem with words. I was actually, it's kind of funny truth. I like to tell my faults in this type of thing, but I was actually a high school dropout before I pursued different things in life. And one of my problems was I had dyslexia. So I liked to read because it was so hard for me to learn to read when I was a kid. Funny to share that, right? And here I am talking in front of you, reading. It's just amazing. So I'll share that story later. Anyway, veterans exposed to ionizing radiation during atmospheric testing, or the occupation of Hiroshima and Nagasaki. There it is. I always mess that up too. Thank you. Our Project 112, actually without me reading through, y'all can kind of see the different areas there. I think the point of this slide is to basically show you that Group 6 does show you the different priority groups and different qualifications of exposures that the VA does recognize when they're qualifying the benefits. And for priority group 7 and 8, these are veterans with gross household income below the geographical adjustment VA income limit for their resident location who agree to pay co-payments. We'll talk about that. Group 8, veterans with gross household incomes above VA national income limit and the geographical adjusted income limit for their resident location and who agree to pay co-payments. All right, we're doing pretty good for time. All right, co-pays. All right. I'm not here to do math for you, and I'm probably going to mess that up, but I want you to see what the numbers look like. These are the current numbers right now for co-pays. So just pay attention to what they are. And for outpatient, if you're used to what you're paying for prescriptions, you kind of have an idea. My wife has always been the one who pays the co-payments and prescriptions in the house. I look at this stuff and I'm like, what does that mean? So just letting you know, I don't know if there's anybody in here like that, but that is definitely me. Anyway, there is a co-pay cap of $700. My wife tells me that's low. Okay. So I wouldn't know otherwise. So I thought that was pretty interesting. Anyway, co-pays. Continued inpatient, same thing, more numbers. First 90 days of care, group 8 copays. First 90 days of care, second one in group 8. What I think is interesting about this slide, and you guys probably see it just as well as I do, the jump from 7 to 8, where your copay, we're talking $281 for a copay, boom, it jumps up to $1,400. You know, I've heard different people in groups tell me, it seems like you get penalized for being more successful. Well, you also have to see the other side of it. There's some people who are just not able to be successful. There are other conditions that happen. Some things that people experience are disabling for them. And I've been exposed to both sides where I can share with you. I know what that's talking about. And there is a reason why they have that in place. Coordinating care with the VA medical centers. Find out if the veteran is already enrolled for VA medical care. I guess I'm supposed to be asking you that, or the medical professional would. But the emphasis here is that I just let you know, please get enrolled if you haven't already done it. At least make the visit. They might tell you you don't qualify, but now they'll have their name and they'll have you started. And remember, there are those 3 groups. All right, for hospice, there is a different set of rules for non-enrolled veterans. Okay, I mentioned that earlier. It's a process we'd rather not see you go through, but at the same time, it is there for you. In other words, you're not going to be not covered. You will always be covered, even if you're not registered. It's just a different process that's more effort on our admission team. And the benefits are a little harder to convey and go over and approve. I'm just going to tell you the truth. The part I'm kind of not wanting to talk about is how hard it is for the caregiver. Whether it's a family member or whether it's a spouse, it's a lot to go through. At that stage where you're already experiencing brain fog, I call it. I mean, because my mom went through something like this when my dad, he passed from hepatitis C. We had hospice in the house. She couldn't remember things like his birthday. She was struggling to remember paying bills. Everything was a mess. And it was just a hard process. So imagine if you're going through the process of caring for somebody, then having to deal with, can they stay at home? Are you able to care for them? It's a hard, hard thing to go through. I'm only emphasizing this because I hate to see people go through it. It's very hard to see, very hard to help folks through this. Any questions on that? All right, coordinating service for veterans of hospice, not previously enrolled for VA medical care. Once again, there is a process in place which is more important for you to see. But ultimately, if you register with the VSO, they walk you through this process. And we do have an admissions team that this is all they do. So more or less, we're just letting you be aware of it. And you have my card, and you know who we are, and you know who Amac is. All right, skilled nursing, home health, in respite care. I get this question a lot, and they've added this in here, and they've developed this quite well. Okay, so let me give you the scenario before I read this. So what happens sometimes if somebody's health begins to decline? The question is, okay, I've already made these preparations, I've already registered, but now I'm at a place where I can't care for the person, I can't pick them up. Having gone through that, my mom would call me, hey, your father fell, please come to the house. So that respite care, when you have to give that extra care, is difficult. And now you have these extra responsibilities where you got to find another facility, maybe you have to make other appointments, you have to make arrangements with families, other things you got to work on. This respite care gave my mom that freedom where she could do that while somebody was able to sit with my dad. Does that make sense? Okay. All right, so I kind of want to make it real world a little bit, only because I think it's important to understand the purpose. The VA provides institutional-based service, nursing home level of care to veterans through 3 programs. VA-owned and operated community living centers, we have that. The community nursing home program, and state veterans homes owned and operated by the states. Any questions on that? Okay. All right, long-term skilled service. The VA is obligated to pay the full cost of nursing home services for enrolled veterans. How great is that? Seriously, how great is that? All right, at CLCs and VA contracted nursing homes, and there's some of the details they share there. Is that lettering large enough? Can everybody in the back of the room see this? Okay, good. All right. sure everybody sees everything up there. All right. Any questions on this? All right. Home health aid program. Veterans must be enrolled for medical care. Once again, that emphasis again. Unskilled assistance from community-based home health providers for at-home assistance. Generally for veterans needing help with at least 3 ADLs. That means activities of daily living. Eating, mobilizing, using the restroom, cleaning yourself. Can be for temporary needs. Available for home and ALF and LTC facility hospice patients. In-home respite. Veterans must be enrolled for VA medical care. Once again, there's that thing. Unskilled assistance from community-based home health providers for at-home assistance. 6 hours for up to 30 days a year. Generally can be used currently with VA-approved home health hours. Any questions on that? Okay. All right. What monetary assistance does the VA provide? Monetary assistance. Disability compensation, VA pension, dependency and indemnity, and certain allowances. So here we go. There's going to be some numbers in here, y'all. Get ready. VA disability compensation. All right, for VA recognized service connection requires filing a claim. Varies with the degree of disability and the number of dependents. There's the basic awards for 2021. Any questions on that? Presumptive service conditions. The VA presumes that certain disabilities were caused by military service, as I mentioned. That's where we start looking at hearing and working with heavy weaponry or machinery, for that matter. If anybody's ever been on a Black Hawk without ear pro, forget it. It's deafening. It's very loud. Anyway, service because of the unique circumstances of a specific veteran's military service. And there's a couple examples you see right there. And there's more, but this gives you a good variety of exposures. Exposed to radiation, we didn't even talk about that. Any questions on this slide? Okay. A lot of good examples there. Implications for service-connected disability claims, qualification for VA medical care, surviving dependent compensation, increased funeral allowances. Once again, we're just going to go over this. This sets up what we're going to talk about. Think about your Vietnam veterans. This kind of talks a little bit about their exposure, the time, what was, how long the war was, what we learned about it. So it tells you a lot about the exposure of something like it says for Agent Orange. Look at that list. They're now 17, so there's several. Agent Orange was very, very, very serious. It's very serious. So they're looking at this. So if you had any exposure in any of those time periods, you could be reevaluated. It's interesting. I've actually met with veterans, and I probably even have some in this room, where they tell me stories about working with Agent Orange and they were working with it as it was going out of the back of a Black Hawk. And then they said, for some reason, that stuff always burned my legs. And then I said, well, what did you say? Did you complain? They said, we said it was burning our legs. I said, what did they do? I said, oh, don't worry about it. It's not harmful to humans. But anyway, so these are stories I'm hearing and things I've never read before. But this right here in this community, I'm learning so much about this exposure that people have had. But it's so sad, even though we can laugh about crazy things that the military says, it's not a problem. And then it is, you know. Yeah, my son has asked me recently, because he's in the 82nd, he goes, Dad, it seems like they treat us like we're guinea pigs, because they kind of put these mandates and they make us test things, they make us use things. And he goes, and then one day they tell us it's bad, and then we're stuck going to the VA to get it treated for it. I don't really have a reply for that, you know. Anyway, aid and attendance. This is actually VA pension. There it is. Service officers don't use the term aid and attendance, so you know. Non-service connected pension, low-income pension, and the types you get are veterans pension and survivors pension. More numbers are about to come. Get ready. All right, well, after this page. Do not confuse the military retirement, and that's, of course, that's why I keep emphasizing that, For honorable discharge veterans with 1 day of active duty wartime service, for surviving dependents of honorable discharge veterans with 1 day of active duty wartime service. And of course, it's based on low household income and limited household saving assets. So let's just say even if you don't qualify, it's good to know, because maybe you have a family member or somebody you know. And by the way, I do get this exposure, and I can give you an example, something to be mindful of, maybe not for yourself, but someone else. I had a young man who recently died. He was a passenger and a drunk driver, and he was an E4. He was still in, EOD soldier, and at the time, his wife and him had separated, and his child was living somewhere else. So situations like that, there's complications where they live, and you'll see some of that, but this is what happens, where I'm going to tell you, she does not have income, but she has a child that has needs, and the father's no longer there. But anyway, we'll see that. So you just have an idea, in case you have family members or a distant friend. Anyway, VA pensions, max possible award, maximum possible rates, veterans pension, veterans, no dependents. There you go. Does anybody have any questions on any of this information? Okay. All right, maximum possible award. This is for the VA pension. Maximum possible rates, survivor's pension. Interesting, right? All right, aid and attendance, increased monthly pension. Recipients require the aid of another person in order to perform personal functions required in everyday living, such as bathing, feeding, and so on. Recipients' disabilities require that they remain in bed apart from any prescribed course of convalescence or treatment. And you guys see the rest there. Required documentation can be filled out by a non-VA physician. Any questions on this slide? Right. Pension disability compensation. Veterans can't get a service-connected disability and a VA low-income pension at the same time. If eligible for both, the higher of the two would be paid. That's kind of a good slide to know about, versus going through the trouble to try to get approved for one but not the other. It may be beneficial if one pays higher than the other. You'd have to determine that with the VSO officer. They will tell you. Beware, okay. Gary, we've discussed this before, where VSOs are here employed for your benefit. However, there are organizations that want to take money by handling these assets. They want to take money by filing these claims. They prey on people that don't know the information I'm giving you. That these VSOs and people like Gary and Amac Foundation are available to help you with this information. Just be mindful of it. And unfortunately, I know that feeling. When I first bought my first home in Florida, I thought you had to pay someone to file for homestead. I did. I was a victim of that. And I know that anger feeling where you send some stranger money, they never do the work, or even if they did do the work, but I paid them hundreds of dollars for something I could have done for free because I didn't know any better. And that's not a good feeling, and I know what that feels like. But please avoid that, and that's how come we put that in here. Please be aware of that. VSOs, and talk to myself or AMAC. Me and Gary would be happy to help you. Look back and penalty period. Okay. This does happen where folks are trying to qualify. Now, the times I see this happen, and this is funny, I want you to be mindful of it though, where folks sometimes go into this and obviously the cost of a facility, the cost of additional care, it gets very expensive. And it almost bankrupts people. So they start getting creative. Let's put money here and hide it here. Let's give money to my children up here, or let's do this with money. You're just better off not doing all that because they'll look back 36 months at your financials. They will find it. And then they'll still qualify you based on what your financials are on that money that you were trying to hide. Can't talk too much about that. I just want to make you aware of it. If you do want to talk about that offline, I can talk to you more about that. All right, dependency and indemnity compensation for surviving dependents, not income-based. Any questions on this? It's kind of self-explanatory, but I'll wait for a second. I see some folks reading. You sure there's no questions on this? All right. By the way, if you want afterwards, I can even help you with this information again if you want like a copy or something. All right, surviving spouse, married to a service member who died on active duty for training or inactive duty training, or was married to the veteran for at least 1 year, or had a child with the veteran and cohabitated with the veteran continuously until the veteran's death, or, if separated, was not at fault for the separation and is not currently remarried. It's interesting to know that those qualifications exist. All right, here we're getting to the end. Burial and memorial benefits. VA national cemeteries, other than dishonorable discharge, suits for veteran spouses and dependent children, the veteran does not have to die before a spouse or dependent child. Good to know. Veteran and spouse dependents at no cost to the family, includes gravesite. Yeah, now some of this detail is important to kind of look at it, and I'll tell you why, because as anybody's ever been to the Bushnell National Cemetery, beautiful grounds, beautiful facility. And if you're buried there, there's no compensation to you. I just kind of tell you where this is building up to. There's no compensation available as far as the burial expenses and the plot, because they provide all that. However, if you do decide that you want to be buried in a particular location, or if that is the plan of your family, obviously they will provide funds for that. We'll talk about those current numbers. All right, includes burial flag and military funeral honors, veterans only. Of note, on Arlington National Cemetery, this is strictly Arlington National, run by the Department of the Army, not the NCA, has different eligibility rules. If anybody had plans to go up there, just putting that out there. All right, headstone or marker. Medallions in lieu of headstone or marker, the military funeral honors, and veteran only. So this is the burial in private cemeteries. VA burial allowances. All right, the veteran has discharged under conditions other than dishonorable, and the veteran died because of service-related disability or for non-service connected allowances. The veteran was receiving VA pension or compensation, or veteran died while hospitalization by VA or under VA contract as a non-VA facility. Or the veteran died while traveling at VA expense to get VA care, or the veteran died while a patient at a VA-approved veteran state at a VA-approved nursing home. Any questions on this? All right. Burial expense reimbursements. Here's your numbers. Service-connected, $2,000. Non-service connected, up to $300. And that second bullet point below there is what I was referring to. If hospitalized by the VA at the time of death, up to 807 burial. So there's a number for the plots, 807. If the death occurred under VA care, costs, or transporting the remains may be reimbursed. No plot allowance if buried at the National Cemetery. It's probably the most important part of that. So make sure y'all see that. All right. A comment. Divorce from a veteran ends all eligibility for any VA-related benefits for the ex-spouse. For future details, any questions on this? I don't know how much time I need to stay on that particular slide. And once again, any of these details, VSO will help you with this discussion. All right, and these are references, and we're done. All right, that's all I got. Well, I guess Gary's not in here for right now, but once again, thank you guys for coming out for this information. And at this time, you do have, of course, more flyers in the back if you need them. And I'll also be standing around, and I have a guest of mine who's also here. His name is Chris. He works with our volunteer department. He can also answer many questions about hospice as well, if you have questions about those kind of details. Otherwise, I just want to thank you for coming out, and I'm going to turn it back over to Gary at this time. And I really appreciate your kindness.
Anybody has any questions for me about AMAC or AMAC Foundation? I'd be happy to address them. And I want to say thank you formally to Ben. He's been an asset for us, and we really appreciate that. I want to make one comment about AMAC and its support of the veteran community. I didn't mention this early on. I mentioned 2.4 million members that we have and growing rapidly. About 31% of our membership is veterans.
Jerry?
And so it's one of the reasons we are. Oh, I'm sorry. I forgot. I'm being recorded. About 31% of our total membership is actual veterans. And beyond that, of the whole 2.4 million members that we have, 3/4 of those members have a veteran connection in their family somewhere. So, you know, it's based on that we consider support of the veterans community a major initiative of AMAC. And so that's why we take it very seriously and do these kinds of things and the Veterans 2021 initiative that I mentioned. So I would encourage you to take a look at that database that I mentioned. Play with it. You can't hurt it. So if you know of any programs that you don't find on there, just send me an email, and you know, we'll get them on quickly. ghafer@amacfoundation.org, or just, you'll see it on the website. Contact information, just contact us and we'll add it to the database. But that's a growing kind of thing. I add entries to that basically every week. You know, we're well over 1,000 individual programs now. So anything that you think should be on there, just let me know and we'll add it. And that's really it. Appreciate you coming here. And we do these things periodically, so watch our foundation website, the events page. We always post events on there as we schedule them. And hope to see you again in the future. So thank you all very much. Appreciate it. Yeah.